Your hands have been tingling again. Not all the time, but enough that you've noticed. Maybe it starts at night, a strange buzzing sensation in your fingertips that wasn't there a year ago. Or maybe it's your feet. You step out of bed in the morning and the floor feels different, like you're walking on sand or on something thick and numb beneath your soles. You shake it off. You tell yourself it's nothing, but it keeps coming back. And then there's the other thing, the fog. Not every day, but more often than it used to be. You're mid sentence and the word disappears. You know the thing you want to say, you can see it in your mind, but the word just won't come. Or you walk into a room with purpose, and by the time you get there, the reason has evaporated. You stand there for 5 seconds, maybe 10, and the thought is simply gone. Here's what most people do next. They mention it to their doctor. Their doctor nods, maybe runs a basic blood panel, and says something like, "Well, you're getting older. This is pretty normal." And you accept that, because what else can you do? But what if it's not normal? What if these symptoms, the tingling, the numbness, the fog, the forgetting, are not signs of aging at all, but signs of a specific deficiency that has been silently draining your nervous system for years? A deficiency that affects 1 in 3 people over 60. A deficiency that most doctors never test for in a standard blood panel. A deficiency that, left uncorrected, doesn't just cause discomfort. It causes permanent nerve damage and measurable brain shrinkage. This is not about managing your symptoms. This is about stopping the damage before it crosses a line you cannot come back from. And in this video, I'm going to show you exactly what that deficiency is, why your doctor probably missed it, and what you can do starting tomorrow morning to protect yourself. I'm Dr. Neuro, and I've spent decades helping people with memory problems, brain fog, nerve pain, and something that too many are told they simply have to live with. One of the most frustrating things I see in my practice, and I've seen it hundreds of times, is when someone walks in convinced their mind is failing because of age or genetics. They've been told that story so many times, they believe it. Their doctor said it. Their family accepted it. And in so many of those cases, that story was wrong. Not because their doctor was careless, but because the real cause was hiding in plain sight, in a place nobody thought to look. Before I go any further, I want to hear from you. Drop a comment right now with your age and where you're watching from. I read every single one. And tell me this. Have you noticed tingling or numbness in your hands or feet that you can't explain? Have you been told your blood work is fine, but you still don't feel right? I want to know, because what I'm about to share might explain exactly what's been happening to you. And if you haven't already, hit that subscribe button, because I share strategies like this every week to help you stay sharp, strong, and independent after 60. Let me tell you about Margaret. Margaret was 71 when she came to see me. Retired school teacher from Ohio, sharp woman, the kind of person who did crossword puzzles every morning and could still quote poetry from memory. But something had been changing. Over the past 2 years, her feet had gone progressively numb. It started with tingling in her toes, then a burning sensation that crept up to her ankles. She also noticed she was more forgetful. Not dramatically, but enough to scare her. She'd forget where she parked. She'd lose track of conversations mid-sentence. She'd been to 2 doctors before me. The first one said it was diabetic neuropathy, except Margaret didn't have diabetes. Her blood sugar was completely normal. The second doctor said it was probably age-related peripheral neuropathy and prescribed gabapentin. The medication dulled the burning a little, but the numbness kept spreading. Nobody investigated why. When Margaret sat across from me, I asked a question none of her previous doctors had asked. I asked what medication she had been taking for the past decade. She listed them off. One of them caught my attention immediately. She'd been on a common acid-blocking medication for 11 years, for chronic heartburn. And when I ran a test that her other doctors had never ordered, the answer appeared in black and white. Margaret's vitamin B12 levels were devastatingly low. Not borderline, not slightly reduced, severely deficient, and nobody had checked. Not once in 11 years. What happened next changed everything for her. But to understand why, you need to understand what B12 actually does inside your body, and why losing it is one of the most dangerous things that can happen to your nervous system. Let me explain this in a way that will make it crystal clear. Your nerves are not wires. They're living tissue. Every nerve fiber in your body, from your toes to your brain, is wrapped in a protective coating called myelin. Think of myelin like the insulation around an electrical cord. When that insulation is intact, signals travel fast and clean. You feel the floor beneath your feet. You recall a name instantly. Your balance stays steady. But when myelin starts to break down, those signals misfire. They slow down. They get lost. That's when you feel tingling. That's when your feet go numb. That's when words vanish from the tip of your tongue. And here's what most people don't realize. Your body cannot produce myelin without vitamin B12. It is biochemically impossible. B12 is not just helpful for myelin production. It is essential. Without adequate B12, myelin degrades. Slowly, quietly, over months and years. And by the time you feel the first symptom, the damage has already been accumulating for a very long time. But it goes even further than your nerves. B12 is critical for your brain. Studies have shown that people with low B12 levels have measurably smaller brain volume, particularly in the hippocampus, which is the part of your brain responsible for forming and retrieving memories. Researchers at Oxford University found that seniors with low B12 had 6 times the rate of brain volume loss compared to those with adequate levels. 6 times. That's not a subtle difference. That's the difference between staying sharp and watching your memory slip away. So here's the question that should concern every single person watching this. Why don't most doctors test for it? And this is where I need you to pay close attention, because this is the part that makes me, frankly, angry. The villain of the story is not some exotic toxin. It's not a rare disease. It's not something dramatic. It's a simple, common, and profoundly overlooked nutrient deficiency that affects roughly 1 in 3 people over the age of 60. Vitamin B12 deficiency. And the reason it's so widespread in this age group is rooted in basic biology that your doctor may have never explained to you. As you age, your stomach produces less and less hydrochloric acid. That acid is what liberates B12 from the food you eat. Without enough acid, the B12 in your chicken, your fish, your eggs simply passes through your body without being absorbed. You could eat a perfect diet and still be severely deficient. You don't need to be vegan. You don't need to be malnourished. You just need to be over 60 with a stomach that's slowing down, which describes almost everyone watching this. And here's where it gets worse. That quiet, natural decline in stomach acid is then accelerated dramatically by one of the most commonly prescribed medication classes in the country: proton pump inhibitors, acid blockers, omeprazole, lansoprazole, pantoprazole, names you've probably seen on your own prescription bottles. These medications are designed to reduce stomach acid. They do that job well, but they also slash your ability to absorb B12 from food. And millions of seniors take them for years, sometimes decades, without anyone ever monitoring their B12 levels. Let me walk you through the cascade so you can see exactly how this destroys your nervous system step by step. It starts with reduced stomach acid, whether from aging or from medication. That leads to poor B12 absorption. Poor absorption leads to falling B12 levels in the blood and tissues. Low B12 means your body can no longer maintain myelin, the protective coating on every nerve. As myelin deteriorates, nerve signals begin to misfire. You feel tingling, then numbness, then burning. Meanwhile, in your brain, low B12 triggers a rise in a toxic amino acid called homocysteine. Elevated homocysteine causes direct inflammation in blood vessels feeding the brain. That inflammation generates oxidative stress, which is essentially rust forming on your brain cells. Oxidative stress damages neurons. Damaged neurons shrink. The hippocampus loses volume. Memory weakens. Thinking slows. And all of this happens so gradually that most people assume it's just aging. It is not just aging. It is a treatable, identifiable, and in many cases preventable deficiency masquerading as the passage of time. Now, I want to pause here because this is where many people say, but I eat healthy, I take my vitamins, I'm careful. Most of my patients believe that too. That's the problem. Margaret ate well, she exercised, she was disciplined about her health, but nobody told her that her acid blocker was quietly blocking the one nutrient her nerves and brain needed most. And nobody tested for it. Here's another question. Where else does this deficiency hide? There are 4 main drivers. The first is the natural decline in stomach acid production after 60. The second is long-term use of proton pump inhibitors, which I've already described. The third is metformin, the most commonly prescribed diabetes medication in the world. Metformin is a good drug for blood sugar control, but studies have shown it reduces B12 absorption by up to 30% over time. If you've been on metformin for 5 years or more, and nobody has checked your B12, that is a problem. The fourth driver is something almost nobody talks about: nitrous oxide exposure during surgical procedures. Nitrous oxide inactivates B12 in the body. A single surgery under nitrous oxide can wipe out your B12 reserves and trigger acute neurological symptoms within weeks. Let me tell you about Robert. Robert was 68, a retired mechanic from Texas. Came to me with severe balance problems and what he described as a brain that felt wrapped in cotton. He'd had a knee replacement surgery 7 months earlier. Before the surgery, he was fine. After it, his feet went numb and his thinking never came back to baseline. His surgeon said it was post-surgical fatigue. His primary care doctor said it might be early cognitive decline and referred him for an Alzheimer's evaluation. When I tested his B12, it was critically low. He'd been given nitrous oxide during his surgery, and he'd also been on metformin for 6 years. Nobody connected the dots. Once we started B12 supplementation in the correct form, his balance stabilized within 3 months. His thinking cleared noticeably within 6 weeks. The damage didn't fully reverse, but it stopped getting worse. And that made all the difference. If you're finding this helpful so far, go ahead and hit that like button. It really supports the channel and helps us reach more people who desperately need this information. So, if the villain is B12 deficiency, what protects you? What can you do starting tomorrow? The truth is far simpler than most people expect, and that simplicity is exactly why it gets overlooked. Here is the single most important rule I can give you, and it is something almost nobody has ever told you. If you are over 60, you cannot rely on food alone for your B12. Your stomach acid is too low to extract it efficiently. You need supplemental B12, and it needs to be in the right form. Not cyanocobalamin, which is the cheap synthetic form found in most drugstore vitamins. You need methylcobalamin or hydroxycobalamin. These are the active forms your nervous system can actually use. A sublingual tablet, one that dissolves under your tongue, bypasses your stomach entirely and goes directly into your bloodstream. 1,000 micrograms daily under the tongue. That single change has transformed more of my patients' lives than almost any other intervention I've recommended in 30 years. Let me tell you about Dorothy. Dorothy was 74. She came to me convinced she was developing Alzheimer's. Her mother had died of it. Her aunt had died of it. She was terrified that every forgotten word was the beginning of the end. Her previous doctor had told her that her cognitive decline was probably genetic and that she should prepare herself. When I tested her B12, it was profoundly low. Her homocysteine was elevated. She had numbness in both feet and had already fallen twice at home. We started her on sublingual methylcobalamin, added folate and B6 in safe doses to help lower her homocysteine, and addressed her diet. Within 4 months, her B12 levels normalized. Her homocysteine dropped. The numbness in her feet didn't disappear, but it stopped spreading, and her memory improved noticeably. She told me she felt like a fog had lifted. She didn't become 20 years younger. She didn't fully recover every lost function, but she regained confidence. That's life-changing. Here's the 5-step protocol I use with my patients, and it is what I want you to consider discussing with your own doctor. The first step is testing. Ask your doctor for a serum B12 test, but also ask for methylmalonic acid and homocysteine levels. Serum B12 alone can appear normal while your tissues are starving. Methylmalonic acid is a far more sensitive marker of true B12 status at the cellular level. Many people with so-called normal B12 on standard tests are functionally deficient when you look deeper. This is the test that catches what others miss. The second step is eliminating the daily drains. If you are on a proton pump inhibitor, talk to your doctor about whether you still need it. Many people are kept on acid blockers for years beyond what was originally intended. If you're on metformin, do not stop it, but ask your doctor to monitor your B12 every 6 months. If you've had surgery with nitrous oxide in the past year, request a B12 check immediately. Never stop or change any medication without your doctor's guidance, but advocate for the tests you deserve. The third step is targeted nutrient protection. B12 is the foundation, but it doesn't work alone. Your nervous system also requires folate, which supports methylation and DNA repair in nerve cells. It requires vitamin B6 in modest doses, no more than 50 milligrams daily, because high-dose B6 can actually cause the very nerve damage you're trying to prevent. It requires omega-3 DHA, the fatty acid that makes up much of your brain's structural tissue. And it requires vitamin D, because vitamin D deficiency, which is epidemic in seniors, amplifies neuroinflammation and accelerates brain volume loss. These are not optional supplements. For many people over 60, they are biological necessities that diet alone cannot reliably provide. The fourth step is reducing chronic inflammation. Inflammation is the accelerant that turns a quiet deficiency into active nerve and brain destruction. Remove seed oils and ultra-processed foods wherever possible. Add fatty fish like salmon or sardines 2 to 3 times per week. Use extra virgin olive oil as your primary cooking fat. Eat berries, which are among the most potent brain protective foods ever studied. Eat leafy greens. Reduce added sugar. Inflammation is not something you feel directly. It operates below the surface. But every inflammatory meal you replace with a whole food alternative is a deposit into the bank of your neurological future. The fifth step is gentle daily movement. Walk for 10 minutes after your largest meal of the day. This is not about fitness. This is about circulation. Movement after eating drives blood flow to your brain and peripheral nerves. It supports something called BDNF, brain-derived neurotrophic factor, which is essentially fertilizer for new brain cell growth. Even at 70, even at 80, your brain still produces new neurons through a process called neurogenesis. Walking stimulates that process. You don't need a gym. You don't need intensity. You need consistency. 10 minutes. Every day. After your biggest meal. Now I want to be honest with you, because honesty matters more than false hope. Nerves heal slowly. Brain cells regenerate slowly. If damage has been accumulating for years, you will not undo it in a week or a month. Some damage, if it's gone far enough, may not fully reverse. That is the truth. But here is the other truth. And this is the one that matters most. Stopping the progression is just as powerful as reversing the damage. Less tingling, better balance, fewer falls, clearer thinking, fewer of those terrifying blank moments when a word disappears, better sleep, more energy, more confidence. Those changes are not small. They are the difference between independence and dependence. And that is the real stakes of this conversation. This is not just about a vitamin. This is about whether you walk steadily into your kitchen tomorrow morning or whether you hesitate because you don't trust your feet. This is about whether you remember your granddaughter's piano recital or whether you blank on it at the dinner table and feel the embarrassment wash over you while everyone politely looks away. This is about whether you stay in your home or whether someone else starts making that decision for you. Numb feet lead to falls. Falls lead to hospitals. Hospitals lead to a loss of independence that is extraordinarily difficult to recover from. Forgotten words lead to self-doubt. Self-doubt leads to withdrawal. Withdrawal leads to isolation. And isolation accelerates every form of cognitive decline there is. That is why timing matters. Catching this now, today, while you still feel mostly fine, is the single most important thing you can do. Here's your action plan for the next 2 to 4 weeks. First, ask your doctor to test your B12 using methylmalonic acid and homocysteine, not just serum B12 alone. Second, begin a sublingual methylcobalamin supplement, 1,000 micrograms daily, dissolved under your tongue. Third, review every medication you take and ask your doctor whether any of them could be depleting B12 or other critical nutrients. Fourth, remove processed seed oils and reduce added sugar from your daily meals. Fifth, walk for 10 minutes after your largest meal every single day without exception. Sixth, observe your symptoms weekly, not daily, because healing is gradual and daily monitoring will only frustrate you. Track how your hands and feet feel. Track how your thinking feels. Write it down. After 3 to 4 weeks, many of my patients notice a difference. Some notice it sooner. Give your body the chance to respond. There is a wide space between miracle cures, which don't exist, and the equally wrong message that nothing can be done. Real progress lives in that space. Your nerves are living tissue. Your brain is living tissue. They are not machines that simply wear out. They are biological systems that respond to what you give them and what you take away. When you remove the drain, when you provide the raw materials for repair, your body still knows what to do, even now, even after years of deficiency. Myelin can be partially rebuilt. Neurogenesis continues throughout life. Inflammation can be reduced. Homocysteine can be lowered. These are not theories. They are measurable, documented biological processes that are available to you right now. I want to hear from you. Drop a comment below with your age, where you're watching from, and whether you've experienced any of the symptoms I described today: the tingling, the numbness, the brain fog, the forgetting. I read every comment, and I want to know your story. If you know someone who needs to hear this, a spouse, a friend, a sibling, please share this video with them. So many people are suffering needlessly because they were told nothing could be done. And that is simply not true. Hit the like button if this helped you, and subscribe for more strategies designed to help you protect your brain, your nerves, and your independence for years to come. Remember, protecting your brain starts with understanding what's damaging it and removing it from your daily life. You have more control than you think. I'm Dr. Neuro. Stay strong, stay sharp, and I'll see you in the next one.